Move so much be considered the reading of the amendment.
So ordered.
I just wanted to ask the floor leader a quick question before I get into the amendment. Are the providers in this grant or any healthcare providers in Maryland required to have any training on human trafficking or sex trafficking as a condition of licensure?
No, there are federally available programs where they voluntarily participate, and so those are run through the Department of Health and Human Services at the federal level. There's nothing at the state level that makes that requirement.
Okay, that's what my research told me, but I just didn't want to lead us down on a road we didn't need to go. Colleagues, this amendment is simply to add that in order to receive funding under this bill, a provider must receive training on human trafficking prevention and identification from the University of Maryland Safe Center for Human Trafficking Survivors, which is provided at no cost. Research shows that human trafficking, survivors of human trafficking often sought medical care while they were being exploited. According to recent studies, 88% of trafficking survivors report having some type of contact with the healthcare system while they are being trafficked. With training, healthcare providers are uniquely positioned to recognize the signs of trafficking, provide support, and connect survivors with resources in the community through victims' services. Now, I want to read to you, and if you do have children, this is kind of a sensitive topic, so that will be up to you if you want to stay in. I want to read to you a survivor's story. When I turned 13, I'd had enough of the abuse in home, and I ran away. I didn't know where to go, so I went to the center of town and stood by the town hall. A man saw me hanging around there, and he said that he was looking for a protege. I didn't know what it was, but it sounded fine to me. He said that I could stay at his house if I didn't have a place to stay. When we got to his house, he pulled out a bottle of gin and had me drink and drink. The next thing I remember is waking up drunk in his bed, all wet and hurt. He took me out on the street and told me what to do. During that time, I saw 10 to 20 men a day. I did what he said because he got violent when I sassed him. I took all kinds of drugs, even though I didn't really like most of them. And over the years, I had pimps and customers who hit me, punched me, kicked me, beat me, slashed me with a razor. I had forced unprotected sex and got pregnant 3 times and had 2 abortions at a clinic. Afterward, I was back out on the street again. I have so many scars all over my body and so many injuries and so many illnesses. I have hepatitis C, stomach and back pain, and a lot of psychological issue. And I have tried to commit suicide several times. That is from Kayla. Kayla's story is typical of women and girls who are trafficked for commercial sex in the United States. And experiences like this one she describes were reported by trafficking survivors who answered questions about their trafficking experiences. And her story represents not the worst that occurs in sex trafficking, but rather the common experience of women and girls who are trafficked. This is evidence that women and children who are trafficked into prostitution are physically, mentally, and emotionally devastated by this crime. And this devastation is lasting, with injuries, illnesses, and impairments continuing for decades. It illustrates how our healthcare system is failing trafficked women and children. And it makes the case that healthcare providers of all kinds are seeing trafficking victims, but failing to identify them, thereby unwittingly contributing to continuing criminal activity and exacerbating both public and private physical and mental health problems for this segment of the population who have already been so victimized. This training will teach providers under this grant to be able to identify victims of sex trafficking. And supporting this amendment says that as Maryland leaders protecting women, we want more providers to be trained to help recognize victims of human trafficking. And I know at this point I can't pass legislation right now. If I would have known that all healthcare providers did not have to have this training, I would have submitted the bill this session. But we can start the process with this grant.
The question before the House is the adoption of the amendment. All in favor signify by saying aye. Opposed?
Roll call.
Roll call. The amendment fails.